Welcome to this session of Wellness Tips for the Whole You. Today's topic is, what is a special needs plan? So what is a special needs plan, also known as SMP or SNP? It's a specialized Medicare Advantage plan. There are three types of SNPs: the dual eligible or D-SNP for individuals having both Medicare and Medicaid, the institutional for individuals who continuously reside or are expected to continuously reside for 90 days or longer in a long-term care facility, the chronic conditions or C-SNP for individuals having both a severe or chronic condition or conditions. What is Medicaid? A joint federal and state program that helps pay medical costs for some people with limited income and resources, such as adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid programs and eligibility are determined and administered by each state. So what does Medicaid provide? Depending on your Medicaid benefits, you may not have to pay out-of-pocket costs for the following: premiums, the periodic payment to Medicare, an insurance company, or a healthcare plan for health or prescription drug coverage; deductibles, the amount you must pay to healthcare or prescriptions before original Medicare, your prescription drug plan, or your other health insurance begins to pay; co-payments, an amount you may be required to pay as your share of the cost for the medical service or supply, like your doctor's visit, hospital outpatient visit, or prescription drug. It is usually a set amount rather than a percentage. Co-insurances, an amount you may be required to pay as your share of the cost for services after you pay any deductibles. Co-insurance is usually a percentage. An example would be 20%. Now, these costs may be covered by Medicaid as long as you qualify for Medicaid benefits and the provider accepts Medicaid. The only exception is that you are responsible for the Part D prescription drug co-payments and your Medicaid co-payments, if applicable. What is Medicare? A national health insurance program for people age 65 or older, some disabled people under age 65, and people of ages, all ages, with end-stage renal disease, which is permanent kidney failure treated with dialysis or a transplant. The different types of Medicare are Part A, hospital insurance; Part B, medical insurance; Part C, Medicare Advantage plans offering both Medicare Part A and Part B coverage; Part D, voluntary Medicare prescription drug coverage. So what does Medicare Part A or hospital insurance cover? Inpatient care in hospitals, inpatient stays in a skilled nursing facility, hospice care services, home health care services, inpatient care in a religious non-medical healthcare institution. What does Medicare Part B or medical insurance cover. Medically necessary services such as physician services, some preventative services such as Pap tests, flu shots, and mammograms. What is Medicare Part C? Part C is a Medicare Advantage plan like SNPs. They're approved by Medicare and run by private companies. They must cover at least all of the medically necessary services that Original Medicare provides. They may provide prescription drug coverage, known as the Part D. They may offer extra benefits, and generally, they have provider networks. What is Medicare Part D? Voluntary Medicare prescription drug coverage. Beneficiaries can choose to enroll in a standalone prescription drug plan to add coverage to Original Medicare. Or if you qualify for a SNP or special needs plan, these plans include prescription drug and they cover all Medicare benefits. What are the benefits of a SNP or special needs plan? SNPs allow for improved coordination and tailoring of services to the unique needs of the population. They include prescription drug coverage. They may cover most of your healthcare costs, and they work with Medicaid benefits and may offer more benefits than Original Medicare, such as dental, vision, and hearing services. So who's eligible to enroll in a SNP? Individuals who have both the Medicare and Medicaid, and there are three types: the chronic condition, the dual eligible, or the institutional. How do you join a SNP? Directly through a special needs plan, by phone, completing an enrollment form, or even online, or through the Centers for Medicare and Medicaid Services, known as CMS. You can call 800-MEDICARE, which is 800-633-4227, the TTY line at 877-486-2048, which is available 24 hours a day, 7 days a week, online at www.medicare.gov. The enrollment periods for Medicare Advantage plans. Now, if you have both Medicare and Medicaid, you may enroll one time during each of these periods: January through March, April through June, July through September. Now, if you make a change, it will take effect on the first day of the following month. You'll have to wait for the next period to make another change. Now note that the special enrollment period, which may be used during the first 3 quarters of the year, is different in the 4th quarter, as CMS has changed the guidelines to permit one election for duals in the last quarter of the year. Therefore, individuals with both Medicare and Medicaid can make changes to their coverage from October 15th through December 7th. However, the change will take effect on January 1st instead of the first day of the next month, as in the other quarters. Some contacts and references for you. Medicare in You Handbook. You can call 800-MEDICARE. Again, that's 800-633-4227. The TTY line at 877-486-2048, which is available 24 hours a day, 7 days a week. You can visit www.medicare.gov, or you're able to visit www.socialsecurity.gov. You can contact the State Medical Assistance or Medicaid office. You can also call Social Security at 800-772-1213. The TTY line at 800-325-0778. You can visit www.highmarkwholecare.com or www.medicareassured.com. You're able to call 877-797-0339. The TTY line is 711, or as always, the Centers for Medicare and Medicaid Services, known as CMS. I'd like to thank you for joining this session of What is a Special Needs Plan? We encourage everyone to follow us on social media and visit our website to learn about upcoming wellness tips for the whole you sessions. As always, stay informed and stay safe.